welcome all of you here. If this is your first introduction to the Motherhood Center, and those of you who are familiar with us, the Motherhood Center, for those of you who don't know, we are a clinical treatment facility for new and expecting mothers that are experiencing what we refer to as perinatal mood and anxiety disorders. The acronym for that is PMADS. We don't love it, but it's what we have. And it's what most people know of as postpartum depression. And at the Motherhood Center, we specialize in treating perinatal women and birthing parents that are experiencing a whole array of different symptoms and diagnoses, including depression, anxiety, obsessive compulsive disorder, bipolar disorder, post-traumatic stress disorder, and in rare but very serious instances, postpartum psychosis. And we do that by offering different levels of treatment that really attempt to meet a new or expecting mother where she is in regards to acuity. We have support groups. We have outpatient treatment, which includes therapy with perinatal mental health specialists and reproductive psychiatrists who specialize in medication that's safe and effective to take during pregnancy and the postpartum. And what we're really, really known for, and what's most special about what we do at the Motherhood Center, is we run something called a day program. And this is for women and both new and expecting mothers and birthing parents that are having a really difficult time with the transition to motherhood and need extra support to help them enjoy motherhood as they're meant to and feel connected and attached to their babies. As we go on throughout this evening, we do have a Q&A option. So as questions arise, please feel free to put your questions in the chat. We're going to save the last 15 minutes of tonight to get through as many of those as we can. And I just wanted to let everyone know that the event will be recorded and that we will be sending out an email to everybody who registered for the event tomorrow. And within that email, we will send you a link so you can watch it if you joined us late, or if you want to share it with a friend, it will also be on our website. So without further ado, I'm very excited to introduce you to our speakers for this evening. I'm going to start with Dr. Liza Natali. She is a New York City-based general pediatrician who has cared for infants, children, and adolescents for over 18 years now. In addition to working in private practice, Dr. Natali teaches grandparent classes at the 92nd Street Y and sits on the scientific advisory board of Nanit, a company that uses modern technology to help new parents better understand their child's sleep patterns and development. We are also joined this evening by Dr. Catherine Berndorf. She's a reproductive psychiatrist and also the co-founder and CEO of the Motherhood Center and the medical director. She wears many hats. Dr. Berndorf is the founding director of the Payne Whitney Women's Program at Weill Cornell Medicine, New York Presbyterian Hospital, where she is a clinical associate professor of psychiatry and obstetrics and gynecology. Dr. Berndorf has appeared on numerous television programs, including The Today Show, Good Morning America, MSNBC, and CNN. And her first book, The 9 Rooms of Happiness, was a New York Times bestseller published in 2010. Her most recent book, published by Simon & Schuster in 2019, is entitled What No One Tells You, A Guide to Your Emotions from Pregnancy to Motherhood. It is so wonderful to have both of you here with us this evening. Really excited to dive into a conversation that feels incredibly timely. And so launching into my first question for both of you, we're in the midst of a national formula crisis right now. Is this a time to be pushing breastfeeding even harder than ever before?
I can start, and I will say, I don't think there is ever a time to push or pressure women into breastfeeding. I think right now, with the formula shortage, there is a lot of media hype around it. In my practice, as well as in clinics, I'm in private practice, in clinics of my colleagues that I've spoken with, it is very rare that people are having difficulty finding straightforward, regular formula. The issue is really the specialized formulas, which very, relative to the number of children on formula that drink formula, is a small percentage. So it really isn't the issue. I feel it's kind of akin to toilet paper, COVID tests in January, things where the media grabs onto it and gets very excited about it. I think this is particularly emotional because feeding your baby is so so primal that it's that much more frightening to think that there may not be formula available. But I have yet to have a family who has been unable to find it. And I don't mean by driving across the country to get it. I mean, locally, we're in New York, but locally. So I don't think it's a time to push breastfeeding. I think if people are choosing, should I wean or should I breastfeed, how much anxiety they have around either may help them just make that personal decision.
I do certainly agree with everything you've said, Liza. And I think that the media coverage, and for the families who are struggling and those certainly talking about it and thinking about it, it is very emotional, and it is happening. So I don't think we can, ignore it. But I think that it does, to your question, Paige, bring up the idea of like, well, should I be breastfeeding? Which I think is a very complicated question. So it does exacerbate what is already a complicated question for many. So,
and just to piggyback on that, Catherine, I think it's always a complicated question, and I think that I don't think people should be sort of scared into making that decision. Is sort of what I was trying to.
Totally agree.
So there has been this perspective that has formulated over time, and we hear about most recently this concept of breastfeeding is best, right? And my question for both of you, and perhaps particularly for you, Dr. Natali, as a pediatrician, is breastfeeding best? And how can new mothers and couples interpret the research on breastfeeding versus formula feeding?
So there is no question that breast milk is the most natural nutrition for babies. It doesn't, best is a loaded word because it's very dependent on the family, the mom, and decisions that they make. So in looking at the research, there is a lot of very soft research, I should say. There isn't a lot of really strong data to support the long-term benefits of breastfeeding for babies. So there is some evidence that breast milk in the first year of life, breastfeeding in the first 6 months to year of life will decrease the number of gastrointestinal infections and diarrhea. It can decrease eczema and rashes. And in premature babies who are less than 3.5 pounds, it can decrease the incidence of a very complicated and serious gastrointestinal condition called NEC. Beyond that, the long-term benefits of decreased obesity, decreased risk of type 1 diabetes, cancer, raising your IQ points, there is really no solid evidence to support that. It doesn't mean that there aren't some instances where, there are anecdotes of like one child, my child never had an ear infection and I breastfed, but that doesn't create a causal link. The one long-term link that has been found is in decreasing the risk of breast cancer in women who nurse. So the long-term benefit is really to the mother more so than to the baby. There are too many confounding variables in how babies are raised and the family structure to make any other concrete assessments.
And I would just add that I don't know that it is better to breastfeed for one's mental health. I mean, to sort of the same question, it's we always say at the Motherhood Center, fed is best. And that's not, we didn't coin that term, but it is really, I think, such a powerful term. Like the most important thing is that the babies get fed. And so, how you do that has a lot to do with who you are and your own sort of psychosocial context. And we'll talk more about that. But, making sure that both the mom and baby are well, enough is really the goal, and to be actually quite well would be, the ideal. So whatever that means and however one gets there, is sort of an individual choice that should and can be discussed with one's doctors and healthcare providers and families, and whatever one chooses should be celebrated, whatever it is, as long as you're getting the kid fed.
Right. Well, let's, oh, go ahead, Dr. Natali. Did you want to add something?
Yeah, I mean, I was just gonna add that it can be very confusing for new families, because there are some, reputable organizations that have glommed on to these studies, which really aren't great studies to begin with, and have made those recommendations. So it makes it that much harder to sort of pick through and making that decision. And when Catherine said fed is best, as a pediatrician, I 100% agree with that. And I think that people make all sorts of decisions about how they're going to feed their baby. And as long as it's an appropriate nutrition for that baby, that is what is essential, because not all families have a lactating woman in them as well. And so we have to be mindful that that doesn't mean that those families are providing less for their babies.
Absolutely. And I want to come back to, because I'm seeing it come up a bit in the chat, Dr. Berndorf, something that you had mentioned, the impact on a new mother's mental health. And I know that this is something that you and I see on a regular basis for women who come for treatment that are struggling with a PMAD at the Motherhood Center. And I'm wondering if you can talk a little bit more about the connection and how you're seeing breastfeeding or the challenges of breastfeeding showing up in the women that we're treating at the Motherhood Center, and for all new mothers that might be stuck in the middle of making that choice and having complications.
Well, as you know, what we see a lot here, and what I hear a lot of, is guilt and shame around a decision that isn't breastfeeding. Now, that may be the population we serve or and treat, but I have found in I would say even since I had kids 23 years ago, I felt pressure. My oldest is 23, so I'd say it's been going on at least that long. And what I would say is it didn't feel good to not breastfeed or to choose at some point to stop breastfeeding if it wasn't at 6 months or a year or whatever was recommended by the American Academy of Pediatrics or whatever body that was putting out information. So I think we see a lot of it, right? So we see women, I can't tell you how many women I've treated over the years who will come in and say, I didn't want to come in before because I think I'm coming to see you, reproductive psychiatrist, for medication for my depression, but I didn't want to come see you because I didn't think I could take medication. And it just breaks my heart because they have been, I'll never forget this woman who was breastfeeding her child. She wasn't looking at the baby. She was so depressed. She could barely do anything except breastfeed. And for her, that was important. And that was her attachment and her bond and what she could give to the baby, but she could have been treated. And we could have done that differently. And there are many medications that are considered relatively safe in breastfeeding and pregnancy. And so it is really unfortunate that there isn't, again, partly why I wrote this book, a couple of years ago, is try to give information so that if you can't get to a reproductive psychiatrist in New York City, which most people can't, that there's information available. And, Postpartum Support International, all kinds of organizations have information out there that sort of help with the medication and pregnancy and breastfeeding. But I digress. I've gone off subject, sorry.
Yeah, I mean, I appreciate what you're saying. And I think for both of you, I think, right, when so many pregnant women and birthing parents in particular are getting ready to have a baby, there's this perception and about, breastfeeding kind of being easy and natural. And it's something that your body just does, right? Like I just ran a group this afternoon and we were talking about breastfeeding and how so many women go into it of like, you have the baby and your breast milk comes in and you hold your baby up to your nipple and the baby latches and the milk comes out and it's this bonding, beautiful experience. And like, that's kind of the expectation. But for so many women who attempt to breastfeed, who have low milk supply, who experience a lot of pain, whose babies potentially have a tongue tie, or for women whose babies are in the NICU, right, and they're not able to breastfeed, and experience these complications, and then sometimes are put on a triple feed schedule, or, you know, how do both of you observe this experience for women that aren't able to do this in the way that they feel so much pressure that they should?
I mean, I think one of the issues, because I see the same thing, I see a lot of, you know, stress and anxiety and disappointment. And I think some of it is that we live in a culture where we are very private about breastfeeding. We have wraps and covers, and we go in the other room, and, you know, and the idea is that, you know, and many young women have never held a baby or babysat or have a sister who had a baby or whatever it is. So it's brand new. And the idea is very much romanticized about, you know, I have breasts so that I can breastfeed when I have a baby. And it's like anything, there's a learning curve and there's a learning process. And I think that I am always comforted by moms when I meet them prenatally. And not only have they done a prenatal breastfeeding class where they've learned a little bit about what to expect, but also that they have the approach of, I'm going to give it a try. I'm going to do my best. And I think that that is always a better setup, because I think when you are so committed that you will do nothing other than one way, I feel like, you know, Murphy's Law, it's always an issue. And you don't know what kind of labor you're going to have, what kind of delivery you're going to have. And I think that I've sort of lost track of what the original question was, but I'm sure maybe I've ended up there somehow. But
no, I think you did great, right? Like that there's a lot of pressure, right? And it does oftentimes feel like there's only one way to do this. And for women that experience complication in this area of the transition to motherhood, it can cause a lot of feelings of guilt, shame, feeling like a failure. I'm not good at this. I'm not doing what I'm supposed to be doing. My body's not doing what it's supposed to do.
And I'm not a good mother, therefore. And so there are certain things that we do culturally that really is not supportive of women, almost by design. That there's one way to be a mother, there's one way to feed your baby, there's one way to to deliver a baby, there's one, and we know that that's not true. And we know that, historically we've had wet nurses and alternative ways to feed our babies, like, when we all lived in the tent and our cousin, aunt, sister, niece were all lactating at the same time. There have always been other ways, and we don't respect that. And we don't respect the fact that it is not always easy. And labor, for those of you who have gone through it, is not always so pleasant. And you're not ready to jump up the next day and have a baby attached to your breast for 15 hours. But I also think there's a lot of misunderstanding about breastfeeding and when the breast milk comes in and how much the baby should be on the breast to stimulate your milk to come in, as opposed to pacify and satisfy the non-nutritive suck. And so I think there's a lot of education that could happen beforehand in a very supportive way, in a much more supportive way, that would give people a little bit more control and feel more confident and less at the mercy of their first postpartum nurse in the hospital, or, their mother.
Yeah, choice. Yeah, absolutely. One of the things that I've seen a lot of, and perhaps we all have, in response to the formula shortage, and in response to, that messaging of, breastfeeding is free, right? Breastfeeding is natural. A lot of this that's coming out of the formula shortage in particular. What would your response be to that that breastfeeding is free. This is a question to both of you. Is that true, do you think?
No. Is anything free? Is there any such thing as a free lunch? No.
Breast milk is free.
It's free. Right.
Breastfeeding is not.
Right. And there are lots of beautiful graphics that sort of show the cost of, what it costs in 1 year for breastfeeding versus formula feeding. And it's very interesting that it's not so different in actual fact, right? When you look at the hard numbers, guesstimating what it costs to do each, and the equipment and all the other things, and the time and the opportunity cost loss. I mean, and the labor and the work you're not doing and all the other things. I think even the idea that anyone thinks it's free is so potentially invalidating dismissive to a new mom who because it sort of speaks to the like, it's free, it's nothing, it's like a nothing burger, and therefore it'll be, you should be able to do it. I mean, the implications just are sort of endless in terms of how demoralizing, demeaning, and dismissive that it is. And right, I won't go on, but yeah.
And I think your point was a good one, that just because it's not even dollars spent, a mother's time is valuable. And if the mother is spending so much time distressed about breastfeeding or pumping or whatever it is, and is not being, not enjoying their baby and being in the moment and playing with their baby, or, getting on the floor with them, I don't see the benefit there. And
yeah, I was just going to say, it didn't even, I remember I'm having like, I don't know, I'm so psychiatrically oriented here. I want to say PTSD, it's not, but just sort of like flashbacks or whatever memories of breastfeeding and thinking like, wait a minute, it takes, you start the baby, the this, the that, all of a sudden, and you're back at the cycle again. And I was like, oh, whoa, I didn't know that. Right. And just like, and time, which is, a very precious commodity. And that doesn't mean it should or shouldn't, you should be able to choose how you spend it. And that doesn't mean you should or shouldn't breastfeed. That's anyone's prerogative, but it really, there are time, money, opportunity costs, so many different things that really, I think, don't get considered when it's just supposed to be natural and easy. It's kind of like having a baby, which people think, or transitioning to motherhood. It's a parallel process. It's the idea that like, yeah, I mean, what's the big deal? It's like, it's easy. It's natural. It's normal. And if you can't do it, right, the implications to all of that, or the flip side is that if you can't do it or you struggle in any way, then there's something wrong with you. You're abnormal. You have a problem, a deficit. And obviously, it's all your fault. And I think that's what gets internalized for moms, new moms, and those who are having what is a very typical and somewhat ambivalent transition to motherhood. Even if you really wanted to have that baby and really wanted to do whatever it is you choose to do, it's to Liza's point, a learning curve. It's very, it's pretty steep. And I don't think we acknowledge that societally, and even particularly for ourselves. I think we are often our own harshest critics.
And I think because we don't acknowledge that, we raise the anxiety level in all arenas of new parenting. So it's not just in the breastfeeding arena, which is a big part of it, but it's in every aspect, because people are like, oh my God, this isn't what I thought it was going to be. Or, right now I don't want to be with my baby. Because I don't want to be with my baby, does that mean I don't love my baby? What does it mean that I don't, it's like all of these things that just piggyback on themselves. And you would also, Paige, in your question, you had asked about it, the nutrition of breast milk. And, I started by saying it's the most natural nutrition, but we also have to keep in mind that, if you're breastfeeding, you need to supplement with vitamin D, because, unless you're taking a large amount of vitamin D, breast milk is deficient in vitamin D for your baby. After 6 months, you need to have an external iron source. So, that's like something that's easily managed, but it's not perfect.
Yeah. You know, it makes me think, and one of the questions that I had prepared for this evening, you know, when we think about the origins of this movement, and we know that a lot of this stems from low breastfeeding rates, particularly for low-income women, right? And we talk about the fact that breastfeeding, in fact, isn't free, and that there are actually a lot of systemic obstacles that make it even that much harder for the very women that this movement kind of started to impact, right? Like when we think about some of those obstacles systemically, right? Breastfeeding makes a lot of assumptions. It assumes that you have paid leave that you can take to be off and spend that time that we've put a high price tag on with your baby. It assumes that you have an employer who's going to allow you to take multiple pumping breaks throughout the course of the day. So like, are there any other, can you speak to that a little bit more? Some of these systemic obstacles that make it difficult for women to continue to breastfeed or even breastfeed at all.
I think one of the things is how insurance companies dictate so much of our care in this country. So they dictate how long a woman will stay in the hospital. So, you know, lactation support is not an indication to keep a baby in the hospital an extra day, and the presumption is, oh, well, you can just do this as an outpatient. For most, you know, I believe some insurance companies do cover outpatient lactation support, but a lot of people have to pay out of pocket, which can be quite expensive. And so I think that fear of, you know, I don't know how to do this and I don't have support when I leave 24 to 48 hours after I've had this baby and have never held a baby. And they've been sleepy the whole time I was in the hospital because that's what babies do for the first 24 hours. I think that that's a big obstacle. I think we would probably see higher breastfeeding rates if and I'm not necessarily encouraging this, but you know, in the 70s, when actually rates were much lower, but women stayed in the hospital for a much longer period of time. If breastfeeding was an important part of that agenda, you know, your milk comes in day 2, day 3, day 4, you'd be in the hospital then. You would see the difference between, you know, a fed, satisfied baby, you know, the comfort of, you know, nursing, not just willy-nilly constantly, things like that. So I think that could be an obstacle.
And I think women who have to, you know, get back to work, who don't have options, who are needing to work, you know, at time, there's so many, or have other kids, right, at home, or right, who don't have support to do this, right? And the money or ability or access to learning, or there's the list is kind of endless about what makes it hard. I'm surprised at, you know, how many women can do it successfully, actually. Like, it is so not easy. It is so not easy. And it is, you know, there are just so many things in the way. And that doesn't mean don't try to figure it out with the supports that you do have. But I just think that the problem is really, you know, that the pressure, right? The pressure and the expectation that anything, right? You know, it's not either or, right? It's both and. Like, it can't be breastfeed or you're bad, you know, or, you know, if you do this, you have to allow people the support to make a decision for themselves that makes sense in their personal context. And I just think, so if you just say, this is how it is, you must breastfeed, breastfeeding is the only option, or this is what we're pushing, that doesn't give the woman any room to have a different experience. And that is a setup for mental health issues.
And I think that pressure of, like, if we have to do something perfectly, we're always a little clumsier in how we do it. It's like you're carrying something that they're like, if you drop this, you know, and then all of a sudden you're like, I've never dropped anything in my life, but now I'm going to drop this. You know, it's that same, like that hyper focus on it. And I do think the support is essential, but the support of it as a cheerleader, as a, like, I do find that there's a shift from mom is pregnant, we're so excited about the baby, and then the baby is born, and then mom was just a vessel who carried this baby, and now we're really focused on the baby and what the baby needs and what the baby, you know, the best thing for the baby and the best thing for the baby and the best thing for, and mom is kind of pushed to the side. And I think, and I have conversations very often with new moms about, like, I mean, this is an amazing thing you did over the past, you know, 9 months. Like, this baby is incredible. And we lose sight of that because we're moving to the next step rather than sort of praising and cheering the mom on, which is what I think a lot of moms need. You know, people need in general. But, you know, in that vulnerable time where you feel like, oh, this wasn't as easy as I thought, I really think that we don't do enough cheerleading in a genuine way, not in a, you know.
Yeah, and what you were saying, Dr. Berndorf, about the both and, I saw one of the comments in the chat, which I think is also so true, is like, we look at these options in such a linear way. You must only exclusively breastfeed, or you formula, right? Or you formula feed your baby. Like, there's so many ways that this can be done, right? You could choose to try breastfeeding your baby once or twice a day and formula feed the rest of the time, right? Like, it doesn't have to be an exclusive relationship or experience. There are so many different ways that this can be done, and that it's okay.
And there's so many.
Oh, sorry.
Yeah, so I was going to say, and I was going to ask you, Liza, I mean, and there are also so many myths out there. I remember hearing them like, well, if you do this, then it's never going to work. Like you said, that Paige, you can breastfeed a couple times a day. Well, in my mind, I'm remembering, well, can you? Because if you don't establish your milk supply, you're done, right? Like, so they're the myths, and they really get in there, and they sit there and they can terrorize you, right? Because you think that you're doing it wrong, that it's not perfect, and therefore, I'll just give up. But really, you can, you know, it's not an all or nothing. It can be an evolving experience. And, you know, there's just not enough support around what makes sense for you. And what is going well and what isn't going as well, and where are those challenges, and how can we help you in the support of what you're choosing?
Because it's nuanced, and we don't live, unfortunately, in a society that is comfortable with nuance.
No,
it really isn't all or none. And I think that what we lose sight of is that you are hard pressed to find a new parent who doesn't want, and I really mean hard pressed, like I can't say 100% of parents want this, but they want to do what's best for their baby. Nobody is making a decision about something thinking, oh, good, this is gonna be harmful to them, so I'm gonna make this decision. We don't have these debates about car seats. You know, we all know, like, a car seat keeps your baby safe. There's nobody saying, nope, I think it's better to sit in the front seat on your lap. You know, this is something that is, you know, in the beginning, to your question, you know, you do want to stimulate your breasts a certain number of times to get some supply. Yes, it can be your baby, it can be a pump, it can be a combination, but there really isn't a lot of evidence to support nipple confusion, which was sort of one of the things it seemed like you were alluding to, like, don't give an artificial nipple, right. You know, that's going to ruin it, right. Or a pacifier. And I think that, you know, I've spoken with several lactation consultants who are sort of more in line with a fed is best approach and supportive of that. And it's really about flow confusion in the beginning. You know, it's about how easy it comes. So I have 6-month-olds whose parents are still using the slow flow nipple, and the baby will refuse the bottle. And I'm, of course they are, because from your breast now it's like a fountain, and that bottle is so slow. So it's really about the flow of it. And I think that I think that it is important that there are many women who will give a bottle and are able to breastfeed, and you just have to see what it is that is your experience. If you offer a bottle and you see that you're having a challenging time getting the baby on the breast, then you stop for a little bit and you work on the breast a little bit more if that's what's important. If the point is, there's not one like, don't do this because it will cause this. That doesn't exist.
Mm-hmm. Liza, you made a comment, Dr. Natali, a few moments ago about how Dr. Berndorf and I make this reference quite a bit, and I actually have found a new analogy where, you know, when a woman is pregnant, all the attention is placed on her, right? She is the center of attention. When are you due? How far along are you? Is it a boy or a girl, right? Like, and then the baby comes and it's like the mother disappears, right? And we have oftentimes said, and I borrow this from Dr. Berndorf, the pregnant princess and the postpartum pauper, right? The most recent analogy I heard is like, you know, being pregnant, you know, the baby is the candy and the mom is the candy wrapper, and then the candy wrapper is cast aside, and there's the candy, right? And I say this because I think, you know, in this transition to motherhood, and breastfeeding plays into this, is like what we lose sight of is mom in all of this, right? And how does it feel to you, right? Like, what is it like to triple feed 7 times a day, to pump, breastfeed, pump again? What does it feel like to you when you're not able to sleep throughout the night, even though psychiatrically it's something that you might require, right? Like getting some sufficient sleep is best for your mental health. Like, those things are important, right? Like your choice and how this feels to you as a new emerging and evolving mother. I think so often women feel like that doesn't matter, right? It's all about the baby and what's best for the baby. I don't matter in this equation anymore, or nearly as much as the baby does. And I'm wondering what either of you might have to say to that.
There's a famous quote that something along the lines of like, there's no such thing as a baby, right? That a baby can't exist alone is the idea. And, you know, it's a relationship. It is really important that both parties are well taken care of and are, and not forgotten, right? And that the mom, you know, again, our culture is not one that celebrates new moms or the transition to motherhood in the way that many other cultures do, where they, you know, support and shower and feed the mom, and the care of the baby is done by someone else or with the mom or in other ways. We try to approximate that in a number of beautiful ways here. And sometimes it works well, and other times many people don't have that luxury. But I just think that you can't forget the mom, right? And I think that's what we see a lot of. And, you know, being a psychiatrist, you know, one of my primary medications is sleep. And when I used to have my old, when we weren't doing electronic prescribing, we had notepads, you know, prescriptions, I used to write sleep. Give this to your family. This is the doc, you know, I'd sign it and I'd say, this is your prescription, because before I'm going to pass out medications, you know, if they're indicated, I am happy to do. But prior to that, what are you doing non-pharmacologically to support your mental health so that you can be the best caretaker for this baby, and the baby has the best chance of developing, you know, healthfully. So it's just essential. And I don't think we think enough about care of the mom in care of the baby, right? It becomes, again, either or. It's the mom versus the baby. It's not. It's the mom and the baby.
Right.
Dr. Natali, I wonder if you can tell us a little bit about baby-friendly hospitals and what they are, and what that means.
So baby-friendly is a designation for hospitals that meet certain criteria in the support of breastfeeding and supporting women in breastfeeding. And to be a baby-friendly hospital, I mean, it started in the early 90s as breastfeeding rates were dropping in the United States. And there was a feeling that they were dropping as a result of like formula companies marketing to hospitals and marketing to doctors and free samples. And so it was kind of having a negative effect on breastfeeding rates. I don't know that that makes sense in isolation. I mean, we're all, you know, prey to that, but I think probably two family incomes, and, you know, I think there were probably other things that played a role. But so in order to be a baby friendly hospital, you have to follow, you cannot accept free formula as you know, from formula companies. You have it, but you pay for it. And you have to follow 10 sort of steps of, you know, supporting breastfeeding. And in theory, it's a great idea. I mean, obviously, anything that's going to help support women who choose to breastfeed is wonderful. In its implementation and even in its name, it to what Catherine was saying, it sort of doesn't realize it's a dyad. It's really focused a lot on the baby, but it's also, you know, you want it to be baby friendly and you also want it to be mom supportive. And so the ideas of it are mom supportive, but it's not in the naming of it. And I think that's powerful. Some of they have modified some of those, 10 steps in 2018, because I think there was a lot of backlash because it was very negative in terms of like, don't do this, don't do that, you have to do this, you have to do that. It still is a little restrictive for my comfort, only because I feel that if we want to be supportive, being so rigid is not typically how people respond well to that support. But it basically, some of the steps are, you know, that you are not to feed your baby anything but breast milk or breastfeed your baby unless it is medically indicated. And that you're to counsel, this is the hospital, you know, the nurses, et cetera, counsel on the risks of feeding a bottle, of artificial nipples, of using a pacifier, and that, you know, labels are supposed to indicate the costs and hazards associated with artificial feedings. So these are all, to new parents, anything that says that is a risk, that is a hazard, is gonna frighten them. And then to say it's medically, unless it's medically necessary, so then all of a sudden it's not a risk or a hazard. But wouldn't a medical, you know, so I think the wording of it is interpreted in different facilities in different ways. Some organizations are more rigid, some hospitals and birthing centers, but that's the idea of it, is to support breastfeeding, but through educating about the value of breastfeeding and the quote unquote risks and hazards of offering an artificial nipple or formula, unless medically necessary, which again is, to me, doesn't totally make sense, because then I'm telling you to do something as a medical provider that you've just been told is a hazard and a risk to help your child. So it's I think it's very confusing.
Mm-hmm. Go ahead, Dr. Berndorf, did you want to say something?
No, I was just sighing.
Okay. You know, when we think about how options might be offered to new and expecting mothers differently, what are some ways that we might be able to kind of do exactly that, right? Like, how might we be able to communicate to women better, differently about their feeding options in a way that doesn't necessarily make them look at this as a myopic journey, that there's only one way, right? Because it really does start, it starts even before having the baby. Like, how might we be able to offer a feeding choice to a new or expecting mother?
And I think I think we have to ask more questions of what the mother wants, what the mother expects, what the mother knows. Has she ever had an experience with a breastfeeding friend or sibling or what have you? Because I think not everybody starts in the same place. And I think giving the education, and also if somebody says like, oh, I don't want to breastfeed, asking how come, but not in a judgmental way, in a way of like trying to understand the reasoning, and then being able to educate if that is a genuine reason not to. If somebody says, because I had a double mastectomy, nobody's going to say, oh, but you should try. But if somebody says, oh, I've heard it's really painful and, you know, you never sleep, then you can educate about, you know, it doesn't, you know, it's not forever painful. In the beginning, it's a learning curve, but it's, so I think we have to ask more questions. I think we have to be more open to what people's fears and what they've heard. And I think everybody who's hoping to breastfeed should take a prenatal breastfeeding class, because I think it's important to learn about the nutritive suck and the non-nutritive suck, and how to, you know, get through those, especially those first couple of days, because they're overwhelming without scare tactics. So I don't think, well, your kid's going to be smarter, not have cancer, not have allergies, not have this, because a lot of that is not real by scientific standards.
I think it does start much earlier. You know, I think that, you know, someone alluded to before about, you know, did you have siblings? Did you babysit? Who were you in the family? You know, what's your relationship been like to babies? Have you ever seen anyone breastfeed, formula feed? But have you ever done any of that? I just think like if we were talking about this, I think about this with, you know, PMADs and postpartum depression and sort of, you know, pregnancy. If we were talking about this in high school and college, and like it's very again, I think it's very culturally and I'm sure regionally and there are so many differences. So I don't want to make a giant sweeping statement here, but I just think in general, if we started earlier, we may build awareness around options and opportunities, and then we could ask questions and be curious about, you know, whether or not, you know, what people knew and were they interested in, did they want to learn more, and here's why it might be a good idea for you and to consider this, right? Again, without pressure. I mean, my big beef is really that I'm against coercion. If there's no right way to do something, and I don't believe we are talking about that here, then we have to offer options, and that we have to support that and be able to think with our patients, clients, colleagues, friends about those non-judgmentally and curiously and sympathetically, and, you know, and just thoughtfully. And I think that's it's a hard thing to do. I don't say that. I mean, that's not easy, particularly because people have opinions, and opinions are just that, opinions. What we're providing is, you know, in some ways our professional expertise and some opinion, and you know, everyone's entitled to that. But hopefully what we're sharing is the idea that there's no right answer here, right? That there's no right or wrong.
And I also think that to your point, what we're sharing as a pediatrician and a psychiatrist are, because we are working with, you know, I work with parents all day long, and I hear so much stress, so much disappointment, so much anxiety, so much guilt about it not working the way that they hoped it would. And so I think that it is really important to not to ignore that. You know, like even if there was, you know, significant medical benefit, which there is not, mental health is also important, and connecting with your baby and being present with your baby. And that's going to help them thrive and develop and grow, even more so
Mhm.
than, breast milk versus formula.
Right.
That's the point. The point is, how do we help children thrive with parents who feel confident and good about their new role as a parent?
Right. Thank you both for that. And I do want to just, noticing a lot of comments coming up in the chat, a lot of questioning around why we didn't have an IBCLC here. And I think that's a really interesting observation and suggestion, and perhaps we'll continue this conversation and bring that perspective in. I think what happens in our field in particular, there are so many disciplines that have that exist now in the field of caring for and supporting new and expecting mothers, right? Like we live in a society now where there are all of these different ways that a mother can be supported. She can, if she has the means, access a lactation consultant, or many. It seems as though sometimes women, access many to try to get the desired effect, or a sleep specialist, or some of these things, if women have the means to do so. And I think really, what's so important in this work for all of us is that we all aim to support women in a very specific area. And we all bring that expertise to the table, right? And it's so important for all of us to understand the woman as a whole, right? She is a person who was given birth. She makes a choice around a feeding option. She has her physical health, her mental health, right? Like these are all things that we ultimately, as providers who come in contact with a new or expecting mother, want to take into consideration. Right? That one piece of that new mother, that there are many pieces to her, right? And the decisions that she makes and struggles and challenges that she has on her motherhood journey, that it's important to learn about those things. And so we can look at her more as a composite and not just focus on one part of who she is and what she's trying to do. And so I think that, what I really appreciate about this conversation tonight is like, we're taking all those things into consideration. And for a lot of women who have attempted to breastfeed or trying still, and it's complicated, that it can have impacts. It can have impacts on their mental health. It can have impacts on many things. And so I really appreciate, the differences of opinions and people's perspectives on this issue. We have a couple of minutes left. And so I just wanted to get to some questions that came in, and want to encourage folks, if you have any last minute questions, to please feel free to post them. I have one question here. Can either of you talk about the impact of mental health when breastfeeding is actually going well? So well, the baby won't take anything else but the breast to soothe, and it's exhausting for mom and she can't sleep.
I was a little distracted reading the comments, which I'm just sorry, Paige.
Okay.
Trying to just see what's going on out there. But would you mind repeating the question?
It was a question about when breastfeeding is going really, really well, and the kind of impact that can have on a new mom, especially if the baby won't take a bottle and only takes the breast.
Listen, I think breastfeeding can be a beautiful, amazing thing for everybody involved. I think that figuring out how to make it work, have it go more smoothly, getting the help from the multitude of practitioners who can support and do this for a living is incredible. And I think if that can happen, it's another, the mom and baby getting to know each other is so essential, right? This baby is new, even if you conceived them, gestated them, and thought you knew them, the baby in your belly, the baby in your mind can be different than the baby that you meet. And I think that it's a journey. And I think that if, when feeding, whether it's breastfeeding or bottle feeding or formula feeding or whatever kind of feeding, that it's another way to get to know this little person who is separate from, they are not an object, they are not an extension of you, they are their own subject who you are getting to know and love and learn about. So I think it's another way, it's a way of closeness and connection, though not always if it's fraught, and it can be a source of tremendous stress and strain. So I think there are many beautiful and wonderful things that can come from it. And I would encourage anybody who's interested in trying to do so. And if that's an important connection, in the journey to motherhood, and in helping a baby develop, then that's spectacular.
And I think if mom is struggling, I think there are ways, it depends on how old the baby is, and ways to figure out other ways to soothe, and helping to support mom figure out that she doesn't have to be a pacifier and a food source and, up all night rocking a baby or whatever it is. So I think, and I piggyback on that. There's no intent in saying that, for those who choose to breastfeed exclusively, that it's not a fabulous and wonderful thing. And for people who want to breastfeed, to get all the support that they can.
For sure.
I think what we're talking about is when there's the disconnect. And you had mentioned, Paige, about why a lactation consultant, someone had commented about that. And I don't know that that's what we're talking about here today, because we know the value of lactation consultants and how they can help support moms in being successful nursers. There's no question about that. What we're talking about is how we, as medical providers who see them after, and they're dealing with the guilt and the shame and the upset of it not working after working with many lactation consultants or this or that, and how do we build them back up? How do we help moms feel that they are still good moms and they are still loving and caring moms? So we all, I think that maybe the idea that we're talking about breast health, I think we're really talking about when there's a disconnect between the desires of mom and the reality of what's happening, and how do we help support them in that moment.
Agreed. I love how you communicated that, Dr. Natali. And I want to just do one more question before we end tonight. And that is the benefits. Sorry for the dog
Your
in
dog.
the background. How do you think the formula shortage is affecting the mental health of new parents?
I think it's making new parents really worried. And I think it's very, very scary to think that you won't be able to feed your baby, because that's like the first and foremost thing of, being a parent, is to feed your young. And so I do think that we are going to be out of this soon. I just encourage people not to stockpile and to be, sharing and caring to those in your community if you have access to it and others don't. But I think that there is formula to be, I'm not talking about prescription specialized formulas, but like the bigger issue is really that about brand preference. So if you're, I only do Similac because this is what my baby likes, this type of Similac, this label, being flexible to other labels, kind of like Coke, Pepsi, whatever generic brand, because they are very, very similar and it's really temporary. But I think it's creating a lot of worry, because this is sort of a primal thing as parents, that we feed our babies.
And to that end, if you can't find formula, because I think we are here in New York City and maybe having a different experience than women who are tuning in from elsewhere, it's crazy making. It's really, really intense to think, as Liza said, that you can't feed your kid. Like there, I can't, that feeling has got to be unbelievably difficult. So yeah, mental health is greatly affected. And as we know, for various reasons at this time in the world, anxiety is skyrocketing, and this is not helping. So.
I want to thank you both for being here. I know we're a little bit after 7. I really appreciate everyone joining tonight and being open to a conversation about, listening to the experience of a new mother and being mindful of her mental health, which I think is something that so often gets left out of the equation. Again, we spend a lot of time focusing on the physical health of babies and women and so little time on the mental health. So I'm really happy we were able to press pause and focus on the mental health of women and how for a lot of women, breastfeeding is something that can contribute to anxiety and other experiences, and just to walk away knowing that feeding your baby is best, that we have choices, and that whatever we decide to do as a mother is okay, right? Whatever we choose to do that feels good to us is right. It's the right thing to do. And I just want to offer that in parting as permission to any new or expecting mothers that have joined us tonight. Also want to let everybody know that we did record this event. We will be sending out a thank you email tomorrow with some additional resources and also the recording for the event tonight. And it will also be up on our website tomorrow if anybody would like to visit it there. So thank you again, Dr. Natali and also Dr. Berndorf, so much for this evening. And we will be having another webinar in June all about the basics of perinatal mood and anxiety disorders, PMAD 101. So also check your email for an invitation to that event as well. Thanks again, everyone, for joining, and have a great night.
Night.
Bye.